months progress. So we're going to spend time on what we've seen so far with respect to secondary health impacts from COVID, their underlying mechanisms, and then most importantly, how we can address these secondary health impacts in clinical practice. In general, what we're recognizing is that through several mechanisms, the pandemic has really increased cardiovascular, metabolic, immunologic, and neuropsychiatric risk. Overall, we're seeing a pattern of more poorly controlled chronic disease and severe consequences from that. These impacts have included increased risk of heart disease and stroke, including of fatal events in those categories. With diabetes, we've seen some improved control, but then some worsening control in other cohorts, and evidence of increasing rates of new onset diabetes and catastrophic consequences of diabetes, including DKA or diabetic ketoacidosis, which was about 8 times higher in the pandemic in one Australian cohort as compared to right before it. We've seen worsening of chronic kidney disease because of interruptions to dialysis and other necessary care, worsening of dementia care and outcomes, including increased death from dementia, lower preventive screening rates and detection for various kinds of cancer, including breast, cervical, prostate, and colon cancer, poorer oral health because of a decline in restorative and preventive dental care. And then globally, what we're seeing is increased risk for perinatal health outcomes. This has included unintended pregnancy rates spiking because of decreased access to safe contraception and abortion services, and to adequate perinatal and birthing care services. So we've seen increases, unfortunately, in maternal and infant mortality rates across the board in many countries. We've also seen developmental and learning loss, especially in the face of these widespread school closures. And of course, there's been a huge spike in new and recurring mental and behavioral health conditions, including depression, anxiety, suicidality, post-traumatic stress disorder, substance use disorder. And there's also been increases in interpersonal violence, as well as risk factors for violence, like increased firearm purchases, resulting in spikes in child abuse and neglect and in intimate partner violence. All the conditions that we've marked with an asterisk are really ones that contribute to the leading causes of death in the US. Here you can see bolded all of the conditions that are leading causes of US death that have either gone up during the pandemic or been adversely affected in some way. And you can also recall that these are all ACE-associated health conditions as well, meaning that those who have had a history of ACEs are also more likely to experience these conditions in a dose-dependent way, and often earlier on and more severely than those who haven't had those ACEs. Many of these conditions will also predispose to more serious infection and death with COVID-19. Overall, about 25% of the excess burden of death in the US since the pandemic has begun is attributable to the kinds of secondary health impacts that we've just reviewed. Now you can see that the experiences that are categorized as ACEs on this slide are colored in red. And those who are listening to this webinar will be very intimately familiar with ACEs, but just to remind us all, ACEs are the 10 categories of adversities experienced by age 18, studied by Kaiser Permanente and the CDC. These include 3 kinds of child abuse, 2 kinds of child neglect, and 5 types of household challenges, which include intimate partner violence and growing up with somebody who is substance using or has untreated mental illness in the household. What you can see is that the secondary health impacts from COVID have necessarily resulted in an increased population burden of ACEs, as well as a decrease in the conditions that really can act as buffering sources. And therefore, we've seen a huge spike in the number of individuals who are likely suffering from toxic stress. Zooming in on one ACE in particular, household substance use, what we can see here is that the CDC collected data showing that deaths from overdoses have really spiked in the pandemic. So you can see pre-COVID deaths in pink and then those resulting since the pandemic began in maroon. So the largest increase has been due to synthetic opioid intakes, followed by cocaine, followed by psychostimulants. This shows ED data from January 2019 to September 2020. The 2020 data is in dark blue, the 2019 data is in light blue for comparison. What you can see here is that after the national health emergency was declared in March of 2020, the number of emergency room visits related to either suspected or confirmed child abuse and neglect that ended in hospitalization rose significantly. So these were the events of really serious cases of child abuse and neglect. And this was despite the fact that reports to Child Protective Services across the US in the same period have really declined by 20 to 70%, depending on where you're looking, largely because this phenomenon has gone underground and there are fewer witnesses and mandated reporters who are in the loop, such as teachers. And child abuse and neglect, as we know, constitute 5 of 10 of the ACEs. So this pattern of increase during the pandemic is true for all of the ACEs about which we have data currently. And as we've said before, we also know that formal access to buffering factors is now lower than it has been in the past. And so this problem needs to be attended to more closely than ever before. When we look at all of the secondary impacts that can result from COVID-19, there are basically 3 buckets of reasons for these kinds of impacts. First, we're all facing a whopping dose of acute stress right now. This is true for patients, this is true for providers, and this results from multiple compounded stressors. There's widespread anxiety about the risks and the consequences of COVID-19. There's grief and loss resulting from the pandemic, economic strains from lost wages and financial assets, widespread school closures, increased childcare demands, profound social isolation and disruption resulting from physical distancing measures, and then the stark moments of our reckoning with racial injustice and other deep-seated inequities in our society. This all represents a perfect storm for acute biological toxic stress activation. Acting through disruptions to neuroendocrine, immune, metabolic, and genetic regulatory systems, this can directly lead to stress-related morbidity and mortality. Hold that thought because we're going to come back to it. 2, there's also been a disruption to healthcare access and resources, especially in the context of job and health insurance loss. There's been shifts away from preventive care and procedures. All of this have disrupted care for chronic disease management, including access to medications and procedures that are necessary. Fear and anxiety about COVID has further decreased or delayed needed care in situations such as emergency departments and urgent care settings, which we'll come back to as well. And number 3, there's been a disruption in opportunities and financial resources for health maintenance activities. There's been, for instance, decreased allowances for safe places to exercise or adequate access to healthy foods, because as we know, the pandemic has really increased financial, housing, and food insecurity across the board. If you've taken the online ACEs Aware training or looked at the provider toolkit, you will know this image well, and you'll remember that toxic stress describes the way in which the brain and the body can encode high doses of adversity, which are not sufficiently buffered by safe, stable, nurturing relationships and environments. Toxic stress can include long-term disruptions to brain structure and function, hormonal axes, the immune system, and metabolic processes throughout the body. This happens via changes to the way in which genes are read and transcribed, which are recognized to be passed from generation to generation. Toxic stress can even change the length of telomeres, which are the ends of DNA, and their length correlates with earlier cell death. Because those who have experienced adversity may already have toxic stress physiology in place, their brains and bodies are what we call biologically stress sensitized in the context of the pandemic. So these individuals are more vulnerable to the impacts of acute stressors and to the stress-related secondary health impacts that we've just talked about. So folks with underlying vulnerability would be those with a history of adversity, those with lower incomes and education, those who might be more vulnerable to job loss, to housing insecurity, food insecurity, poverty, and those with underlying chronic health conditions, disabilities, and older age. So those with pre-existing adversity, as we're saying, are at greatest risk both biologically and sociologically for the added impacts of acute stressors, like the COVID-19 pandemic and all of its consequences. And thus the equity lens is really crucial to incorporate when we're thinking about preventing and mitigating some of these secondary impacts. I'd like to take a minute just to consider how toxic stress directly increases risk for a couple of the health conditions we've talked about already, so heart attacks and stroke specifically. We can have similar charts for other diseases, but here what you can see is that acute stress directly increases sympathetic output, which results in greater blood pressure and heart rate. It also increases inflammation. And then thirdly, it creates a hypercoagulable state by a few different mechanisms that include endothelial cell dysfunction, platelet and hemostatic activation, and increased blood viscosity, which altogether end up promoting easier clot formation and then predisposing folks to having strokes and heart attacks. Immediately following the start of the pandemic, even though we know that physiologically people are primed as a result of toxic stress physiology to have more severe cardiovascular and cerebrovascular events, the CDC published data showing that ED presentations for both heart attacks and strokes fell by about 23% and 20% in those months. This was largely due to fear about contracting COVID rather than to a decreased incidence of these conditions. This is data from Kaiser Permanente in Northern California, which showed that the overall rate of hospitalization for heart attacks decreased by almost 50% during the first 2 months of COVID-19. So the red line compares 2020 to the year 2019 in yellow. Similarly, we know that acute stroke presentations have decreased overall in the pandemic also, down 30% according to one report from Ohio. Similar to heart attacks, what we're seeing is that early risk factors for stroke are being missed. Here you can see data from Denmark that shows that after the pandemic began, in March and April, there was about a 50% decrease in the cases of atrial fibrillation that were being detected, that are shown in the blue bars. Atrial fibrillation is an arrhythmia of the heart that predisposes to stroke. So what was seen is that the odds of a stroke or death resulting from first-time atrial fibrillation that was underdiagnosed in this context during lockdown. So stroke and death resulting from undiagnosed AFib was about 41% higher, shown in the dashed and the solid lines here. Because we know what a large role the stress response itself plays in causing these disease flares, regulating that stress response is a very important part of the treatment strategy for secondary health impacts from COVID. And this is what we're championing here at the ACEs Aware Initiative. These evidence-based strategies are sure to be super familiar to the viewers here, and they are enhancing supportive relationships, high-quality sleep, balanced nutrition, physical activity, mindfulness practices, access to nature, and then mental health care as needed. As Dr. Jelly and Dr. Ball are going to describe further, attending to ACEs and toxic stress now in patients is more important than ever before. And to learn how to optimally assess for toxic stress risk and how to implement strategies to regulate the toxic stress response, we encourage all providers to get trained at training.acesaware.org.